Usually we perform breast augmentation after 20-year-old girls because after 20-year-old the all milk channels and breast tissue is mature and can be handled very easily. In the first month, the breast augmentation patients has 10% of bigger breasts as normally, but after 1 month it regresses to normal size. Aesthetic procedures, surgical procedures on breast is not increasing cancer risk because the cancer is starting with other points, not about the surgery. Sometimes we can discover the cancer points after that aesthetic surgeries. So it can be an early knowing of the cancer. Usually after 3 weeks of breast augmentation, they can start to make daily exercises. For breast reductions, it can be after 6 weeks. So it depends the patient. In some patients, we are waiting for 2 months. It depends, but usually or averagely we can say 1 month they cannot exercise. After 1 week of surgery, they can turn back to their daily life, driving a car, doing job on a table, or making some shopping. It's possible after 1 week. Nipple sensation loss because the surgical techniques are very evaluated, and now we can 100% cover that point, so they don't feel that. After the surgery, we have some scars. The breast augmentation patients have some small scars, infrabra or periareolar incisions, and if we do lifting or vertical reduction, that time we have a linear scar on the breast. Well, after 1 year, there will not be noticeable. It will be very small and non-noticeable scars, but of course, these surgeries left a small scar. We are using Mentor and Polytech branded silicones, implants, and they have warranty and they are worldwide known brands. They also register their patient, and after a while, if you forget what you have, that firms can help you what you have. That's a good thing. Most of our patients are young women, so they do breastfeeding after they had prosthesis. There is no problem. Also, the prosthesis also helps to the serving the milk because they're pressing behind the breast wall, and it's easy to have a breastfeeding. 1 day is enough for breast surgeries. There is no suture removals and there is no drains we use, so they will have some tapes on the breast, and that tapes can be taken out after 2 weeks, and it can be taken out in their country by house doctors or nurses or themselves, so it's easy. And after taking out the tapes, they use some ointments for scar recovery. If the nipple areolar complex is lower than 20 centimeters, we do the lifting and augmentation together. It also helps to provide a fullness at the upper pole and making a more good-looking outcome. So lifting and augmentation can easily be done together. After reduction patients, some of them continue to having bigger breasts because of the tissue involvement is continued, and that time in 20 years maybe they can have a lifting or a small reduction, maybe according to patient. There is no relation with pregnancy and breast surgeries. They can have any time, and of course they can have the breastfeeding after 1 year. So if they start to have a pregnancy after the surgery, so in the 9 months of the surgery they can also provide breastfeeding, no problem.